we have from the Canadian Association. If we could just hold the noise down, please, everybody. All those in the room, can you just keep the noise down? Thank you. So, Canadian Association of Public Health Dentistry, Dr. Embroidered Singh, welcome. He's the president of the association. And from the Saguenay Port Authority, we have President Chief Executive Officer Carl Laberge. So we will start with Dr. Singh, please, for opening remarks.
Thank you to the chair and committee. Good afternoon, everyone. My name is Dr. Embroidered Singh, current president of the Canadian Association of Public Health Dentistry. I'm also an assistant professor and director of Inclusive Community Outreach at the College of Dentistry, University of Saskatchewan. I'm extremely honored to be invited today to represent the Canadian Association of Public Health Dentistry, which I'll also refer to as CAPHD, as a witness to the House of Commons Standing Committee on Finance in view of its study of Bill C-59. The CAPHD is the national voice for dental public health in Canada that exists to support members, government institutions, and agencies who are dedicated to improving oral health and assuring oral health equity for Canadians. Well, first of all, on behalf of CAPHD, I would like to applaud and acknowledge the tremendous efforts made by the federal government on the latest phase of development of the Canadian Dental Care Plan. This unprecedented initiative will enable many of our equity-deserving Canadians to access much-needed oral health care, potentially improving their overall health and well-being while decreasing the burden of oral disease in Canada. The CAPHD promotes and advocates for equitable oral health care for all Canadians. We will continue working with the government partner organizations and our membership to support CDCP and advocate strongly for its uptake and utilization across Canada. The CAPHD is closely following the phased rollout of CDCP and eagerly awaits early reports regarding plan, enrollment, and utilization. Our association believes that it is critical for the CDCP to remain responsive to the evolving needs of Canadians. Continuous evaluation of the CDCP will be important for informing data-driven policy adjustments, and interdisciplinary collaborations will be vital in enhancing its effectiveness. As the plan matures, the CAPHD looks forward to more emphasis on preventative services for caries and periodontal diseases. This includes upstream services that increase oral health literacy, such as oral health education and counseling, and encouragement of interventions addressing the microbiology of dental decay and gum disease. To encourage more healthcare providers to support the plan and increase access to care for underserved Canadians, the CAPHD proposes alignment of the CDCP fee with the existing provincial fee guides in the future. We believe that harmonized compensation rates will encourage more providers to participate in the plan. Additionally, CAPHD would like clarification on how healthcare providers can coordinate benefits for individuals eligible under more than one public insurance, be it federal, provincial, territorial, and/or municipal. This clarification is essential to streamline the processes for healthcare providers and ease financial burden for eligible individuals, which aligns with the CAPHD's preference for minimizing out-of-pocket expenses for patients. By addressing these key areas, CAPHD aims to encourage greater provider participation in the plan and support a sustainable model of care. Success in these endeavors is contingent upon the active involvement of healthcare providers, equity-deserving communities, and high-risk populations. CAPHD commits to advocating for enrollment strategies that actively engage all crucial stakeholders and promote provider enrollment within its membership. These collaborative efforts may enhance plans' reach and impact and support Canadians to access oral health care that they need. However, I would like to take this opportunity to emphasize that access to care barriers are complex and multidimensional, especially for rural and remote communities and high-risk population groups, and if I also may extend that to include inner city areas. Hence, in future planning, we urge the government to consider investing more resources to address the access to care barriers. Again, the CAPHD expresses profound gratitude for the recognition of oral health's vital role in the overall well-being of all Canadians. The CDCP has potential to contribute towards increasing our population health significantly in the forthcoming years. And by prioritizing oral health, we anticipate a notable reduction in overall burden of disease, thereby alleviating pressures on our healthcare system. Thank you.
Well, thank you, Dr. Singh, and there'll be a lot of time for members' questions. And now we are going to hear opening remarks from the Saguenay Port Authority, and Mr. Carl Laberge, please.
Well, good afternoon, Mr. Chairman, members of the Standing Committee on Finance, and first of all, I thank you for the invitation to appear before you today. As administrator for the Port of Saguenay, it's recognized as one of the 17 most strategic and important ports in the country. For the area here, it plays a crucial and growing importance on the Canadian supply chain, strategic for the corridor between Saguenay, St. Lawrence, and Great Lakes. We're a young port, but we have enormous potential. In fact, our maritime capacities, our strategic location, will allow us to develop a vast industrial port zone, 3,000 acres, dedicated to industrial projects on a major scale in link with our activities. We're working in close cooperation with the Government of Canada and the Government of Quebec in order to attract structural projects to develop new and innovative industries. In fact, in order to do this, we're probably best positioned for these. It is a strategic corridor for Canada, and it is important to the prosperity and the sustainability of the Canadian economy in matters of renewable energy. It also offers a unique opportunity to develop the Canadian economy in a very sustainable fashion. The Government of Canada, by means of the National Trade Corridor Program or Fund, I'd like to thank the excellent collaboration of your Minister of Transport, Mr. Pablo Rodriguez, and our effort to do the financial assistance for the new infrastructures here. We're currently limited in our capacity for transporters and maritime. We only have one such port, and the transshipment efficiencies are in short demand. Therefore, we have bottlenecks. The infrastructure will, with the assistance of the fund, will be able to improve these portuary aspects and improve the efficiency of transport of goods. Government of Quebec has already given its participation, $20 million announced last year. We're still waiting for the Trade Corridors Federal Fund to top up this financing. We have to stress the crucial importance of investing in our port infrastructures to ensure essential service. I'd like to take this opportunity, of course, to deal with our limits on loan capacity in our letters patent. Port administrations and authorities in Canada are limited by their borrowing capacity, by the government and a government framework. We have to maintain good access to financing in order to attract more capital and be more competitive. Now, important infrastructure projects are underway. To date, we haven't received our patents proper, and we continue to work in order not to slow down the work and the development of this by the FNCC And what we can do, of course, all depends on when we get those supplementary letters patent. We are actually working on major projects, and we have locked up most of our liquidity in order not to slow down the progress. Investments are required, and the supplementary finance is necessary, quite reasonable, and we are sure that with your support we can avoid any delay in obtaining these letters patent and continue to build an efficient supply chain throughout Canada with Saguenay as a nerve point. Thank you very much.
Donc, merci, Dr. Singh et M. Laberge. Nous allons passer à notre premier tour de questions, donc 6 minutes pour chacun des députés. Nous allons commencer par M. Morans. Merci, Monsieur le Président, et je voudrais remercier nos témoins d'être ici, enfin d'être en Zoom. Nous avons entendu toutes sortes de rapports sur toutes sortes de questions, mais je voudrais commencer par m'adresser à M. Singh. M. Singh, quand on parle du régime de soins dentaires du Canada, moi ce que j'en comprends, c'est qu'il y a peu de dentistes qui sont intéressés à fournir, à devenir...
Is that your understanding as well?
That is, yes.
And do you know why that is?
Well, it is an evolving information. I have also been following news and listening to any releases from the provincial associations. Well, from our understanding, one thing is with any change, there may be a bit of a hesitation, but I think I'd be making assumptions right now. I don't clearly know where the hesitation is. From the population health standpoint, our goal lies to promote the uptake and utilization of plan at all levels.
Yeah. Have you discussed this plan with any dentists? May have expressed their concerns to you?
I have talked to dentists, and you know, there are mixed views. There are dentists who are really passionate about community health and see great benefits of this plan, especially for patients who never were able to afford dental care. But some of the hesitation that anecdotally heard was the unknowns yet as the planned rollout was happening. So I guess not all the information was out at once. So my understanding is that may have created some hesitancy.
What would be an example of an unknown?
Well, it is the phased rollout of the plan as was planned by the government. So we did not have all the details all at once. So the details are coming out, and we are becoming more and more aware. An example of that would be yesterday, the news release was that dentists now may not need to enroll in the plan, so that they're automatically enrolled. So that is just one example of the clarity in the process. I believe it's coming out.
So some dentists might not want to participate because they were thinking they would have to enroll. Now it's coming out that maybe that's not necessary. Is that what you're saying?
That would be my assumption.
And are any other reasons that they've given you for concerns around providing care under the program? Specifically?
Well, in my opening, I did mention as the association, we did brief on if there is better alignment of the fee with the provincial fee guides. That may be one of the reasons that we I don't want to use the term incentivize, but it is, again, if providers are compensated at the similar level of the provincial fee guides, that may be one solution to address this.
Is there a significant level of increased administrative work within private dental offices that could be an issue for some for some dental offices?
I cannot comment on that. I'm not aware of the level of administrative work that is required to ultimately, when the claims are being made. So sorry, I'm not able to comment on that.
One of the policies that our leader, Mr. Polyev, has put forward is something that we're calling a national Blue Seal program. It's to try and address a problem where professionals come to Canada from other countries and they have trouble getting licensed here. So what we've proposed is a 60-day pathway to testing, so they're not waiting forever. There are many, many qualified doctors, dentists, nurses in the country that are not practicing in their professions. Would you support an effort like ours to try and get more dentists, licensed dental hygienists, things like that may come from other countries?
I definitely would. We are well aware of the shortage of oral healthcare providers in Canada at all levels, be it dentists, dental assistants, dental hygienists, dental therapists. I think this initiative has a potential to address those barriers significantly, especially when I think about rural and remote communities, and then now think about CDCP with the potential increase in influx of patients. So the providers who may be going to the rural and remote communities now, if they see suddenly influx in the cities, I just worry that that may create that disparity and create even further shortage of providers in rural and remote communities if we don't address the number of providers in our country.
Lastly, just one very quick one. What about an opportunity for something like a young dentist just graduating from dental college who wants to build a practice? Is this an opportunity for dentists that are just starting their practices to perhaps build a practice more quickly?
To understand it correctly, would it be through working in rural and remote areas?
Anywhere, just by agreeing to provide care under the Canada Dental Care Program. I can see a young dentist coming out of dental college without any patients. They might look at this as an opportunity to build a practice.
I definitely would think so. However, I do not think that there is that, there is need for care everywhere. So,
Thank you.
This may just
Thank you,
enhance that.
thank you, MP Morantz. And now we'll hear from MP Weiler, please.
Thank you, Chair, and I do want to thank our witnesses for being here today. Likewise, I do want to pick up on that last line of questioning from Mr. Morantz with Mr. Singh. You mentioned some of the barriers and gaps that you're seeing with dental providers across the country, and you particularly mentioned the recommendation to invest resources to address these access to care barriers. I was hoping you might be able just to elaborate on what the relative shortages are in rural and remote areas.
Well, I'm aware of some communities, especially in northern and rural Saskatchewan, who do not have a dentist, have not seen a dentist in many years, and patients have to travel at least 7 to 9 hours one way to see an oral healthcare providers. No, there have been existing therapists in some communities, but there is shortage of oral healthcare providers at all levels. And I just think that these access to care barriers, now even if dentists enroll in the plan and CDCP is implemented, but if we are not doing something specific for the northern and rural communities, I just think that it may create further divide if we don't specifically invest resources in that area. And some of our populations who suffer disproportionately are the ones who have not seen dentists in years.
No, that's a point very well taken, and someone that does represent some rural areas, although I wouldn't necessarily categorize them as remote. I know there is a big need. And as you may have seen in the budget that we just tabled a few days ago, we are announcing our intention to expand the eligibility for the student loans forgiveness for dentists and dental hygienists that work or go to work in rural and remote communities. And do you see this type of a measure being an incentive that will help get more dentists and dental hygienists in those rural and remote areas that you just highlighted there's a big gap for?
I definitely see that, especially if there is a return of service agreement of some sort to specifically target the communities that have been historically underserved. On top of it, I just do not want to forget to highlight that cultural safety piece also is important. So ensuring that training happens in right way for these future providers also is essential. So any investment in training specifically would also be beneficial.
Definitely. And since this plan has launched, we've seen over 1.7 million eligible seniors sign up, and they're looking forward to getting the oral health care supports that they need. I know I've done a few town halls in my own riding, and people are very excited about this as well. I was hoping you could share with this committee, how can we keep this momentum on the importance of maintaining dental hygiene as other cohorts will begin to be eligible to apply, and how does that align with your mandate of your association to assuring oral health equity for Canadians?
Thank you. I just think that the preventative services, the hygiene, anything that we could do more upstream in terms of education, the scaling for the patients, the hygiene appointments, this is ultimately is going to prevent the disease burden, and it cannot happen overnight or in a few years. We have seen a huge disparity over past number of years, so it's going to take time. My view and suggestion would be to just keep the communication plan very strong, and in cases where targeted communication is needed for senior groups or for adults, I mean, for certain communities in certain languages, so nobody feels left out that I did not know what to do.
No, I think that's very, very sound advice. In the Canadian Association of Public Dentistry's 2020 submission to committee, your organization stated that, quote, people of lower socioeconomic status, immigrants, Indigenous populations, the working poor, and the elderly make fewer visits to the dentist than those with a higher social and economic status. And I think it would be fairly obvious that a Canadian shouldn't have to choose between groceries and a visit to the dentist. So I was hoping you might be able to explain to those in the room who don't support providing Canadians with equitable access to dental care why they should support the Canadian Dental Care Plan.
Well, we have known that cost has been one of the barriers to accessing dental care, for especially relevant for people with low socioeconomic status. In other cases where there was no availability of services, so the physical availability of services is also important. But from my work and from discussions in our association, there is yet another barrier that is not generally talked about. It is about the mistrust of certain population groups and patients with the healthcare system, and the stories of discrimination and racism that exist. So I think it is about how do we build systems that support where providers build trusting relationships with patients and vice versa, so that the hesitancy when cost is not the barrier. So how do we move forward in a way that is respectful with the patients? So that becomes especially important now when we are addressing cost-related barriers.
Thank you, and thank you, MP Weiler. And now we'll go to MP Samari, please.
Oui, merci, Monsieur le Président. Donc, salutations à messieurs.
Thank you, Chair, and congratulations to Mr. Singh and Mr. Laberge. My questions are for Mr. Laberge. Thanks for your participation. It's quite inspiring. You said that your port at Saguenay is one of the 17 top significant ones for the Saguenay, Saint Laurent, Seaway, and Great Lakes. You talked of 30,000 acres for new industrial port zone, critical minerals, supply chain dependability. We're very concerned with economic productivity. It's very difficult to create more progress, particularly in regards to supply chains. How explain to us how strategically important your facilities are for all of this development? Well, thank you. It's strategic on many levels. We're one of the very few deepwater ports in Quebec. We can really accommodate very large pan-type ships. And of course, we're linked with rail, and we have great warehousing and stockage space. The infrastructures have some limitations, of course. As I said, part of our problems here is a limited capacity in transshipping facilities. We're going to be mechanizing bulk container ships, and we have another project in the pipeline for which we will need some supplementary funding from the strategic corridors so that we can maintain the pace of development. We're at the most important crossroads for trade in Canada for aluminum, for the forestry sector, and given the great potential for innovative industrial development, as you've just said, it's unique in Canada. All sorts of opportunities in a number of other sectors, and we want to serve this clientele. We have to, of course, build infrastructure that will last. In the winter, we have to slow down construction projects, of course, and we have some commitments and timelines. And the Quebec government is a very important partner, as well as the federal government, for this industrial development. Bottom line, what we're trying to establish now is our winning conditions so that we have a logistic, strategic supply chain. We're only a link in the chain, a very important link pin, if you will, but as I said, transshipping is going to be very, very important in near future, and we would like to dedicate at least some of our facilities for that. And of course, large-scale major projects for new industries for energy purposes. And we're trying to prepare the industrial park to suit many multiple needs. It's a unique situation, and we will be able to serve a number of great areas. But we have to maintain the momentum. We need the support of all our partners, federal, provincial, for infrastructure programs and funding. We will need supplementary financing. We would have liked to see more in your last budget, but we are very optimistic. So it really, really is a strategic amount of infrastructure of port, and we can help to promote more economic progress. Now, you talked about the assistance you received from Minister Rodriguez. You've always requesting, of course. Quebec granted you, what, $20 million last fall? And then from the federal government in Ottawa, you haven't got a response yet to your request for funding. Was that done 5 months ago, or is just bit of a slowdown from the center. Well, we submitted our request for funding at approximately the same time, July 22, I believe. So July 2022, Quebec answered you in November 23. Now we're in April of, or May even, soon, of 2024. So we'll be asking questions on our end as well to the Minister of Finance, for example. Now, this consequential patent letters, you said it was rather, if the delay is too excessive, too long, you won't be able to get the supplementary funding. And how would that occur concretely for the administration of your port? Well, quite concretely, we are in building mode right now, where we are actually doing major projects, and they're strategic. We can't. It's on a smaller scale, perhaps, than that of Montreal or Vancouver. We just don't have the financial means to do that. But for $110 million, we'll have to borrow significant sums. We've had the support of the Quebec government on that. They'll back us. But in order to be able to borrow that money, we need the authorization of the federal government as well. We have to modify our letters patent in order to up the cap and the go ahead from Transport Canada. We started the process last year to get access to more capital to continue our projects. But some of these delays are very complex, and it's losing steam as we go along if we wait too long. Many of the analysis said the recommendation is sound, but it has to go through the Ministry of Finance. We have to have oversight from transport, etc. What we'd like to see, of course, is that the file be dealt with as quickly as possible so that we can address ourselves to Transport Canada, get the amendments to our letters patent, and not lose too much momentum on our works. We have a whole lot of other projects in the drawer waiting to go, and it is going to slow down quite a number of other projects. But we don't want to imperil the current project because we don't have the capital, because we don't have the authority to borrow the capital. Thank you very much, Mr. Semari. Deputy Davies.
Association of Public Health Dentistry. Is it Mr. Singh or Dr. Singh? Hello?
Hello.
Is it Mr. Singh or Dr. Singh?
Dr. Singh.
Oh, thank you, Dr. Singh. Dr. Singh, the research I've looked at says that Canada has a ratio of about 65 dentists for every 100,000 Canadians, and that ratio has doubled since the 1960s. I also am aware of data that shows that there's an oversaturation of dentists in major urban centers like Vancouver, Toronto, Montreal. So my question is kind of twofold. Is the problem that we don't have enough dentists in Canada, or that we have enough dentists but they're just not evenly distributed where we need them in the country?
Well, I think some centers, I'm not aware of all the cities that are saturated, but some centers may be. But I highly think it is about the equitable distribution of the providers, and what opportunities are we creating for providers to be in areas that are high need. So I'm not aware of why these providers may be choosing to be in the urban centers. Well, lifestyle resources, from my understanding, would be one of the reasons. But as we are launching a plan like CDCP, I think we also have to be mindful of how do we bring services closer to home for community members who haven't had services in years.
I very much agree, and that's why in Budget 2023, the NDP secured $250 million over 3 years, starting in 2025.
and $75 million ongoing to establish an oral health access fund. Are you aware of that fund?
Just to the level that you have described, but I'm not sure about the details of the fund yet.
Okay, yeah. Well, what that fund is for is precisely the issues you've identified. We are aware that rural areas, underserved areas, remote areas, and frankly, even in urban centers that may have enough dentists, but there are issues of access. Issues of access for people living with disabilities. This fund is meant to address that, and I think it will be open fairly soon for people to apply to for innovative and creative ways. I've heard of things like mobile units to go into care homes. I've heard of a proposal to outfit a train car. We've talked, and we're going to talk, I think, to the next witness coming after this about establishing special access for people with disabilities, maybe someone who's in a chair or someone who's nonverbal, et cetera. So there is hope on the horizon. Dr. Singh, you have said, you published a statement on the CDCP saying to encourage more oral health providers to support the plan and increase access to care. The CAPHD proposes alignment of the CDCP fees with existing provincial fee guides in the future. I agree with you, by the way. What is your understanding of what percentage of fees the CDCP's 2024 fee guide covers as a percentage generally of the provincial fee guides?
Well, from the information that I've been hearing, there has been some consideration to increase the fee guide from 82% to about 88%. That's my awareness right now.
If the CDCP pays dentists 88% of the fees that they set by themselves in the provinces, would that be sufficient, do you think, to attract dentists to the plan?
I am not able to speak on behalf of the dentist providers, but I just think that what would be the incentive then for people to take on more work? Let's just say if administrative work is required, more work is required, and it is especially if there is more administrative work but less compensation, that may not be attractive for the providers.
Sure. Well, good news on that front, too. I mean, those concerns have been raised for the last 2 years, and I understand that the CDCP will have a reimbursement goal of money being repaid within 48 hours. Actually, the goal is within 24 hours, and it should have no more complicated administration than any other dental plan that offices work with. I guess the other advantages I would mention is the federal government, of course, is a guaranteed payer, so there's no chasing bad debts. So if the plan is streamlined, easy to use, guaranteed payment, quick payment, and as you said, you understand the fee guide's about 88%. Given those factors, do you see any reason why dentists may be reluctant to join the plan? Other than the money.
Well, the other factors, again, would be if the practices, the existing practices are already full and the providers are at their capacity. So then we would have to look at how do we increase that capacity by bringing in new providers or creating opportunities for internationally trained providers.
Yes.
To become licensed in Canada.
In your view, I mean, you clearly care a lot about marginalized communities who don't have access. Do you think that the CDCP should prohibit balance billing in order to minimize out-of-pocket costs for patients, especially, obviously, low-income and poor patients who haven't been to a dentist in many years?
Well, in my opinion, we should look into opportunities to just not have the balance billing or to harmonize the fee guide, so then we are not creating tough situations for anybody, providers or patients.
Yes, I agree. Thank you for that.
Davies, and again, members, so we have very limited time, so we've got about 2 minutes per party for a question or two from each of you. So I think it's MP Lawrence, yes?
Yeah.
Okay.
Merci. Mon question pour Monsieur Labarge.
My question to Mr. Labarge.
Clarify, just sometimes the translation, they do their best, but it's not 100%. But I almost couldn't believe what I heard. What is stopping your expansion? And I understand there's millions, maybe more, on the line. Is simply a government change with respect to the letters patent. Is that correct?
Actuellement, nous,
Currently, we have many projects underway. We're doing construction.
to do payments, to make them advance to entrepreneurs, and we have loans that are on the side and that we cannot have access because we are not allowed by our letter patents. Our letter patents limits our ability to borrow money, and we have to have permission from the government, basically changing our letter patent to have access to that money. So, analysis have been done at Transport Canada, and, but they have to have cannot say the blessing, but I mean the permission from finance as well
Sorry, my time.
give us that permission. Yeah.
My time's short. So, getting these letters patents fixed, what type of economic outcome? Like how many jobs, how many millions in flows, how much in construction, if we were able to get this done?
Actually, it's just to make that work on the way. Our work is on the way. It's if we don't have it, we're gonna block everything. We have $110 million on the way actually, and we might stop that work if we don't have those letter patents.
Thank you, sir.
And now to MP Thompson for a couple of minutes.
Thank you. And Dr. Singh, and thank you to both witnesses, but Dr. Singh, I'm going to ask you in closing, and I know it's a very short period of time for an answer, but clearly this is a historic investment. And can you explain how investment in the Canadian Dental Care Plan is going to impact, and that access to oral health care is going to impact the health care of so many Canadians who haven't been able to access full or even partial oral care?
Absolutely, you said it very well. It is historic. It is a milestone for all of us. Oral health care is on the table, and like many, I'm pleased to see that myself. We are aware that mouth is literally the gateway to the body. It impacts how we function on day to day, what we eat. Any type of dental pain, if someone has experienced in their life, they would know that it is quite discomforting in a way that inhibits anybody's ability to eat, to smile, to function. So I think this investment it has a lot of potential to not only improve oral health but overall health. There are many demonstrated oral systemic linkages, and so this has potential to actually also decrease burden on the acute care setting, on the emerge settings when people had to then end up in emerge for oral health care issues.
MP Thompson, and now to MP Samari.
Oui, merci, Monsieur le Président. Donc,
Thank you, Chair. For Mr. Leberge, rest assured we're going to do a follow-up on your letters patent. I see that Ms. Koutrakis is very, very active in following up on various files. So together with all our colleagues, we're going to make sure that we get behind this and push it. Now, you would have liked to see more support for the administration of the ports. We're giving you a chance here for any final comments. The FNCC program is very, very appreciated, as you know. We're talking about supply chains. An office was created by the federal government to deal with this, and we're going to need to invest there. Ports are assets that belong to the public, and we have to make sure that they stay current and up to date. So we need to fund that adequately. The fund is very, very popular, of course. and everybody would like a piece of the cake, so it's a lot of competition from within. It limits the opportunities if we can't get the proper funding. Well, as you explained quite clearly, it's an important priority because it will, in fact, support continued development of our economy. And I would like to thank you very much, and I'll do my best to convince my colleagues to get behind it as well. Thank you very much.
And now over to MP Davies. This will be the last questions for our witnesses.
Thank you, Dr. Singh. Dr. Singh, the CAPHD has said they'd like clarification on how healthcare providers can coordinate benefits for individuals eligible under more than one public insurance. That means federal, provincial, or territorial plan. You said that's essential to streamline the process for providers and ease the financial burden for eligible individuals, which aligns with the CAPHD's preference for minimizing out-of-pocket expenses for patients. It's my understanding, Dr. Singh, that the federal government is in active negotiations with the provinces that likely will make the federal government the first payer, and then if there's a social services program, that the persons on the province or territory will be the second payer. In your view, would that be an acceptable coordination of benefits?
I would think so. Yes, if there's better alignment and better understanding along with the communication and clarity, that would help.
Finally, you have also said that it's important that this plan remain responsive to the evolving needs of Canadians. Can you basically give us an idea of the kind of data we should be collecting or what we should be looking for to make sure that this plan remains responsive and, in fact, maybe becomes even better?
Right. I think this includes diverse range of metrics, including from what areas people are coming to receive service from and where. So I think I'd be most interested personally to also see if people living in their home communities are able to receive services right where they are. So data related to that, data related to income levels, socioeconomic status, and how much people paid out of the pocket, because I know there are income categories based on which the copayment is decided. So evolving data on that would also be helpful for future directions as to if there is hesitancy for patients to accept treatment based on the out-of-pocket expenses, or this is seen as a positive and more people are receiving the care that they need.
Thank you, MP Davies. And we want to thank our witnesses, Dr. Singh, Monsieur Labarge. Thank you very much for your testimony on behalf of our Finance Committee. We really appreciate it. And we are going to be transitioning now to our final panel for the day. So we'll suspend and get those witnesses in as quickly as we can. We are here with our final panel for today, and we have with us Associate Professor, Sprott School of Business, Carleton University, Mr. Ian Lee, who's no stranger to this committee. As well, we have from the Canadian Association of Public Health Dentistry here in person, the immediate past president, which is Mr. Keith De Silva. Welcome. So with that, we are going to start with Professor Lee, if you can provide your opening remarks to the members, and then we will go to, is it Dr. De Silva? To Dr. De Silva after that. Okay. So, Mr. Lee, please.
Thank you, Chair Fonseca. First, my disclosures. Number one, I do not belong to or donate money to any political party at any level in Canada. Two, I have taught at Carleton University for 37 years, teaching the strategy capstone course that evaluates the competitiveness and value creation of industries and firms across the United States and Canada. Number three, over the last 30 years, I've taught over 100 times in EMBA in multiple developing countries that experience very low economic growth, massive inequality, corruption, and poverty at levels not seen in Canada. As I am not here to plead on behalf of any interest group, business, or NGO, after all, I'm not a lobbyist, I will deal at the level of macroeconomic philosophical direction with the budget implementation bill. The fundamental problem, in my judgment, with the previous budget and the current budget is the overarching belief in the following fundamental principles. Number one, belief in the top-down or centralized decision-making by politically directed non-market bureaucracy using public funds of citizens produces superior outcomes to decentralized private decision-making by investors taking risks with their own money. Two, superior economic growth and prosperity will be realized through expanding the role and size of the public sector to direct and guide and substitute their decisions for private strategic decisions by corporations and investors. Three, fairness is defined as treating business investors